Your leg is broken. There is no hospital. There is no ambulance. There's only your tribe, your hands, and whatever the land around you can offer. This sounds like a nightmare. For most of human history, it was Tuesday. For roughly 300,000 years, humans have been breaking bones, getting infections, losing teeth, and surviving injuries that should have killed them. And somehow, again and again, they made it through. Not with luck, with knowledge. Knowledge passed down, tested, and refined long before anyone had ever written a single word. So, how did they actually do it? What did ancient medicine really look like? And why does some of it sound less like folklore and more like something out of a modern surgery textbook? Let's start with a skeleton that changed how scientists think about the past. In 1957, archaeologist Ralph Seletsky began excavating Shanidar Cave in northern Iraq. Inside, he found the remains of several Neanderthals who lived roughly 45,000 years ago. One of them, known as Shanidar I, had a shattered right arm, a crushed eye socket, and severe damage to one leg. He was likely partially blind, possibly deaf, and almost certainly unable to hunt on his own. Here's the part that matters. He didn't die from those injuries. He lived for years afterward. The bones had healed. Someone fed him. Someone protected him. Someone kept him alive long after he stopped being useful in any practical sense. That is not an accident. That is care. Deliberate, sustained physical care in a world with no medicine cabinets and no antibiotics. Question: if a badly injured man could survive for years in an Ice Age cave, what exactly were his people doing right? Part of the answer is splinting. Long before anyone understood bone biology, ancient humans figured out that a broken limb healed straighter if it was held still. Archaeological evidence from multiple prehistoric sites shows fractures that healed in near-perfect alignment, which almost never happens by chance. Broken bones move. Muscles pull them out of place. The only way to get a clean, straight healing pattern is to immobilize the limb using bark, stiffened hide, or bundled reeds tied tightly around the injury. It's the same basic principle as a modern cast. Different materials. Same idea. Hold the bone still, and the body does the rest. Then there was infection, which was probably the real killer, far more than the injury itself. A wound that stayed open was a wound that could turn deadly within days. So ancient humans developed something remarkably close to modern wound care. Certain plants were pressed directly onto cuts. Yarrow, for example, has natural properties that help slow bleeding, and it shows up again and again in the archaeological and ethnographic record as a wound treatment used by traditional societies across multiple continents. This wasn't guesswork, repeated once. It was knowledge tested over countless generations, refined the same way any technology gets refined. Try it. See if it works. Pass it on if it does. Now for something stranger. In the 1990s, researchers studying Ötzi the Iceman, a naturally mummified body found frozen in the Alps and dated to roughly 3,300 BC, discovered something odd on his skin. Tattoos, not decorative ones. Simple black lines, clustered around his joints, specifically his lower back, his knees, and his ankles, exactly the places where later CT scans revealed degenerative joint damage and arthritis. Researcher Albert Zink, who has led extensive study of the Iceman's remains, has pointed out how closely the tattoo locations match modern acupuncture points used to treat joint pain. That means 5,000 years ago, someone may have been marking or treating pain points on a suffering man's body using a method that resembles a therapy still practiced today, whether it was pain relief through pressure, through ritual, or through something we don't fully understand yet. The placement is too precise to be coincidence. Let's push further into something that sounds almost unbelievable: skull surgery. Trepanation is a practice of cutting or scraping a hole directly into the skull, and it is one of the oldest surgical procedures ever documented. Anthropologist John Verano, who has extensively studied trepan skulls from ancient Peru, has found that a striking number of these patients survived the procedure. The bone around the hole shows healing, meaning the person lived for months or years afterward. In some regions, survival rates climbed remarkably high over time, which tells us something important. This wasn't random. Ancient surgeons were learning. They were figuring out where it was safer to cut, how to avoid infection, how to keep a patient alive through an operation that sounds like it belongs in a horror story rather than a doctor's office. So let's reconstruct what this might have actually looked like. Picture a young hunter with a severe head wound after a fall from a cliff, swelling building dangerously beneath the skull. An older woman in the group, someone who has done this before, presses her fingers along his scalp, feeling for the softest, most swollen point. She has likely used a stone blade, sharpened patiently the night before. There is no anesthesia. There may be plant-based painkillers, chewed bark, fermented drink, pressure applied elsewhere on the body as a distraction. The hole is made slowly, scrape rather than punch, to control bleeding and avoid damaging what lies beneath. Afterward, the wound is packed with paste, likely plant-based, possibly with some antimicrobial property, discovered through trial and error over generations. He is watched constantly for days. If he survives the first week, his odds improve enormously. This is not primitive guesswork. This is applied, tested, generational knowledge, refined the same way a modern surgeon refines technique, just without a textbook, just without a name for germs or infection or nerve damage. Only observation, only pattern, only what worked repeated and what didn't abandoned. Here's the counterintuitive twist. In some ways, ancient injury treatment may have been more effective than early modern medicine. For most of the 1800s, doctors in European hospitals still didn't wash their hands between patients. Infection rates in hospital wards were often worse than infection rates from wounds treated at home. Ancient and traditional healers, by contrast, had thousands of years of accumulated trial and error behind their wound care, even without understanding germ theory. They knew, empirically, that certain plants worked and certain practices spread disease, even if they couldn't explain why. Sometimes the untrained intuition of deep experience outperformed the overconfidence of early formal science. Anthropologist Polly Wiesner, known for her decades of fieldwork among the Jew/Hoansi in southern Africa, has documented how much of this traditional medical knowledge is transmitted socially, through stories, through elders, through the same evening fireside conversations that pass down everything else a community needs to survive. Medicine wasn't a separate category of knowledge kept in a book. It was woven into daily life, tested constantly, and carried forward by whoever remembered it best. There's one more piece of this puzzle worth sitting with. Splinting, wound care, even skull surgery, all deal with the body after something has already gone wrong. But some of the most interesting evidence points to prevention and to pain management that had nothing to do with plants or blades at all. Consider dental work. Researchers examining ancient teeth from sites in Pakistan and Italy have found drilled molars dating back roughly 9,000 years. Small, precise holes bored into teeth to remove decay, long before metal tools existed. The drilling was done with a bow-driven flint point, the same mechanical principle later used to start fires. Someone figured out that spinning a sharp point fast enough could bore through enamel without shattering the tooth. That is not a lucky accident. That is engineering applied to a mouth thousands of years before the word dentist existed. Think about what that actually required. Someone had to notice that a rotting tooth caused pain. Someone had to test whether removing the rot stopped the pain. Someone had to design a tool capable of doing that precisely on a living person, without killing them from shock or blood loss. And then someone had to teach it to the next person, and the next, until it became a known, repeatable skill within the community. This is a pattern behind almost everything in ancient medicine. Not a single genius moment. A slow, brutal, iterative process, conducted in real time on real bodies, with real consequences for getting it wrong. Every splint, every plant paste, every trepanned skull represents not one decision, but thousands of small decisions stacked across generations. Each one testing to last, each failure quietly discarded, and each success quietly kept. Now think about your own life for a second. You live in a world with sterile bandages, antibiotics, and surgeons who train for over a decade before ever touching a scalpel. You will probably never need to splint your own arm with bark, or judge whether a head wound needs to be drained with a stone blade. But the instinct underneath all of it hasn't changed. When you're hurt, you still want someone to notice. You still want someone to stay. Shanidar didn't survive because of one clever trick. He survived because his people refused to let him go. That instinct is still in you. It's the reason you check on a sick friend. It's the reason you flinch when you see someone fall. It's the same wiring that kept a broken, half-blind man alive in an Ice Age cave 45,000 years ago. Your leg is broken. There is no hospital. There is no ambulance. But there is your tribe. And it turns out that was almost always enough.